At Woodrow Wilson Rehab Center, we have a spinal cord injury clinic. The clinic can be used for several purposes. It is staffed by a team of specialty clinicians who have a lot of experience with spinal cord injury. Each clinic is staffed by a nurse, a physiatrist, an occupational therapist, a physical therapist, and a case manager. When a person comes to clinic, they get a nice about 90-minute evaluation done by different members of the team, looking at items such as vital signs, general wellness, range of motion, items that are more specific to spinal cord, such as how they're doing their transfers, how their skin is looking, what types of exercises they're doing at home, how their bowel program and bladder care is progressing. All of those items can be looked at in a spinal cord clinic visit, and recommendations can be made for either change to one's program if change is needed, for the confirmation that you're doing the right thing if indeed things are going well, or possibly even open an avenue for more therapy being indicated at that time, depending on reality of goals, etc. When you have a spinal cord injury, it's very important that you get specialized lifelong follow-up. It's a condition that often small, subtle changes are seen over time, and sometimes those are best observed by a team that's most experienced in looking at this particular diagnosis. Spinal cord injury clinic is a great way, whether you have only been injured for a very short period of time and perhaps are looking for more rehabilitation. It might be your first step to getting in our doors for a rehab program. If you've been injured for a year or two and perhaps maybe even 3 and have been through a program at our facility before, it's a great avenue for being followed up to see what changes can be recommended at that time to keep you moving forward in the right direction. And if you've been injured even 10, 20, 30 years, sometimes it's very appropriate to come back to help you see what is new, what's changed, how things are being done differently. And we just encourage anyone who's interested in such a visit to call our pre-admissions department and inquire to learn more about the clinic and to get set up with an appointment.